Well, there's plenty of evidence that during the pandemic, the number of people who are not able to actually get enough food for themselves and their families has dramatically increased. Research during the hard lockdown showed some adults, many adults, were not eating so they could make sure that their children had enough food. At the same time, I'm sure you've seen how the cost of living is going up. Economists say it's true that the price of food is rising more quickly than the other figures that make up inflation. Well, the charity FoodForward SA is now opening another mobile rural depot in Emalahleni in Mpumalanga. Their managing director is Andy Plessis. Andy, good afternoon to you. Thank you for your time. What kind of need are you seeing for food, simple food at the moment?
The need is growing and escalating on a daily basis, Stephen. Thank you very much for having us. What we're finding, especially in the rural communities, there's just no resources and people are left without food. If you look at the NewzRoom Wave 5 report, the report shows that millions of people are going without food for a week, sometimes 2 weeks, with absolutely no food at all and no means of being able to get food. The application base into our network to get food assistance from us has quadrupled in the last year. And the number of applications a year ago that averaged, 25, 30 applications a month, we are now seeing 250, 300 applications that we have to process a month. So the demand for food across South Africa is growing rapidly.
I think some people think, well, the lockdown's pretty much over. Why would there still be such a need for food? But clearly you're seeing on the ground that that's not how this works. I presume it's because people have just run out of money.
Absolutely. So although the lockdowns are over, the effects of the pandemic will last for the next 24 to 36 months, economists tell us. So during the lockdowns, millions of people have lost their jobs and only a small percentage have been able to find work since. So we talk about roughly 30 million people, that's 50% of our South African population, that are left vulnerable and severely malnourished. In other words, they're going without food for days on end, which is why we opened the Emalahleni mobile rural depot. We have 28 of these mobile rural depots across the country, serving towns and villages, remote areas and villages, where our trucks go and take food on a monthly basis, nutritious food to vulnerable communities. In Emalahleni itself, we are providing food to aged care facility. A lot of the aged people receiving the grant are not able to survive just on the grant, and they need additional food support to maintain nutritional levels, to maintain their strength, and to fight off hunger. We also support a youth center there because of the growing unemployment rate in the municipality, as well as orphans and vulnerable children. And this is what we're doing across the country. So it's easier and cheaper for our trucks to go and take food on a monthly basis rather than to set up physical facilities that cost us quite a bit operationally.
What kind of food are you actually able to provide? And I know the better quality the food, probably the more expensive it is for you.
Absolutely. So our model is premised on what's called a food banking model. It's a model that's practiced across the world globally. And what that does is we are able to connect with farmers, wholesalers, retailers, and manufacturers. And we have discussions around taking all these surplus offtakes. So throughout the food value chain, from farm to fork, there are huge amounts of food surpluses. For example, something goes wrong on the production line and millions of units, maybe the label goes skew and millions of units can't go onto a shop shelf. A farmer harvests for a retailer, but half the stock is not within spec, but it's good stuff. It's got a blemish on it, whatever the case may be. We are able to take that kind of food. So over the last year, we were able to maintain a 97% nutritious food average of the food basket that we're providing. So maize meal, rice, pasta, fruits, vegetables, baked beans, and other basic essentials we were able to receive from our food donor partners. And then a percentage of that is procured. Roughly 10% of our total food requirements are procured food, so that we are able to make sure that we balance the basket to our beneficiary organization population. That's now nearly 2,000 beneficiary organizations strong, reaching close to 850,000 people on a daily basis.
Are you finding so? I mean, you rely, I imagine, on donations as well. You talk about food partners, but also food that you need to buy. After the pandemic, are you getting less donations, less money donated just because people can't afford to give anymore?
Absolutely. We are seeing a downward trend in large donations from corporates. And that's simply because, corporates are trying to rebuild. Corporates are trying to strengthen their businesses, rehiring staff and improve their bottom line. So a lot of that is happening. But what we also see happening is a number of smaller donations are coming in from individuals, 100 Rand a month, 200 Rand a month, 500 Rand a month, 1,000 Rand a month. So our monthly giving program has increased quite substantially. And what we found that in 2020, with the onset of the pandemic, we did receive large corporate donations. And at the beginning of 2021, and even with the July riots, when our own warehouse burned down and our truck was stolen, we found large corporates coming to our aid, supporting us, rebuilding our operations within 2 weeks. But donations are tapering downwards. We find that definitely a trend at the moment as businesses are trying to rebuild.
There's another dynamic to this, and you're talking about food for people who are absolutely desperate. But for people who can still afford to buy food for themselves, bread maybe is still, if you're lucky in an urban centre, you'll find bread for 10 Rand a loaf, 20 Rand in some areas, depending on the type of bread. But food that's better for you, vegetables, for example, those prices are going up quite dramatically, and that's often the food that people really need. You're finding that people can maybe feed themselves, but they can't feed themselves in a healthy way.
Exactly. They're not getting the proper nutrition. You're hitting the nail on the head, Stephen. So what we are finding is that over the past year, our research has shown that food price inflation has increased 9.9%. Fruits and vegetables, yogurts and other dairy products, as well as protein sources like meat and unrelated products have gone up substantially. So we find that the bulk of our 50% of our population that are poor can't afford healthy food, which leaves them compromised in terms of their health, which means they place an additional burden onto our already burgeoning health system. And those are the people that need the nutritious food. So access to nutritious food is diminishing significantly. The NewzRoom Wave 5 report also confirmed that people are not getting access to nutritious food. They're eating whatever they can get. And most of the time, it's unhealthy food, it's oily foods, and it's foods that's not nutritious. And that's leaving people getting ill sooner and not being able to fight any illnesses and diseases that may present in their bodies.
Andy du Plessis, I really appreciate the time. Thank you very much indeed. The Managing Director of FoodForward South Africa shows you what's happening in our society at the moment. Well.